January has been named National Glaucoma Awareness Month in an effort to educate the country of the sneak thief of sight. Glaucoma is an eye disorder that is caused when there is a tendency towards sensitivity in the rear of the eye that affects the eye's nerve, even if that is a normal pressure. That pressure can do damage to the back of the eye if you are susceptible.
Those that are most susceptible, it certainly seems like, are people that are farsighted, and also people over the age of 40 and have a family history of glaucoma. It's recommended that anybody over the age of 40 be evaluated on an annual basis as you would for your other medical concerns.
Dr. Currier says people sometimes don't realize the onset of glaucoma because it steals the peripheral vision first, something Currier says people don't normally pay attention to. But the doctor says rarely do we see advanced stages of the disorder because people receiving eye exams over the age of 40 are usually checked for glaucoma symptoms. In the past 30 years, Dr. Currier says he has treated tens of thousands of people with glaucoma in the Alpena area. And while there are many different types of the disorder, one stands out as the most common.
It can be from people having trauma in their eye, people being born with glaucoma. There's an entity called congenital glaucoma. There's also when people have inflammations in the eye, they can have what we call a secondary glaucoma, but by far and away the most common cause is the one we were talking about earlier, where people do not realize they have it, and that represents a population of probably anywhere from 2 to 4 million people.
Currier says over 50% of the people who have glaucoma are not diagnosed at this time. Visiting your eye doctor and requesting an exam of your eye's rear nerve is a good way to see if you do have a sensitivity to pressure and if it is necessary to perform further testing for glaucoma.